from Union Territory of Jammu and Kashmir, and that also aspirational district of Kupwara, which is border district, which is far flung of the country, and my journey has started from there. I acknowledge Mr. Gaurav Gautam, his company, Hub Edge, who has given the opportunity to all of us, the entrepreneurs, those who make the difference in the healthcare, in the education, in the industry, whichever to highlight their achievements. Thankful. We should have great applause for such people. Because it's one moment or one single word which will stimulate any young man or a person of any age to do something for the nation. My story starts from a village in Kupwara, Gushi. Born there in 1967, passed my matriculation in 1982 with 25th position in J&K board. I entered my medical school when there were 2 medical colleges only on 17th serial in Medical College, Srinagar. I completed my post-graduation, that's MD, from Sher Kashmir Institute of Medical Science, the prestigious institute of the country. I completed my 3 years in gastroenterology. Then for different reasons, I had to leave the country. I worked across different countries, traveled a lot, Europe, St. Petersburg, Hong Kong, Macau, worked in Bahrain, the mini America, Gulf countries, have, to my credit, more than 80 scientific publications in international journals. That's British Medical Journal, Infectious Disease Clinical Practice, and with more than 150 citations. But being there and serving there was one thing always in my mind, that whatever I am a second-degree citizen there. I'm brown, I'm Indian. They don't. They have the different attitude towards their nationals. On the airport when you go, there is one line for the visa checking for some people. Other line is for you. You work there, though being a doctor, though being the most important, taking care of the health. Leaving your own country and serving there, but still you are a second-degree citizen. You stimulated me after heading the emergency department there, doing my MRCP there, doing advanced cardiac life support and ATLS, advanced trauma life support, being a physician, topped it, did the advanced trauma life support instructor course also. I thought the expertise we got, the experience, the lives we save here, I wish I give it back to my people, to my country. The patriotism comes from when you leave abroad, from the country, away from your country. The nationalism you come to understand when you interact with people of the different countries. This stimulation is enough. I feel those who are living in the US, even born there, the UK, in different parts of the world, working there, still they will be feeling that they are Indians and they miss something. There is some discrimination, especially in the present era. So this stimulated talk is there. That having thought of that, what should I give back to my people? I thought they are the taxpayers. With whose money I did my graduation, I did my post-graduation. So I left there, joined Medical College, Srinagar, as a consultant in medicine. In 21st century, we didn't have the triage system there. We didn't have ICU there in the tertiary care hospital. The people coming from far-flung areas. See, all of us will not be from the metropolitan urban states here. Some will be villagers. Can anybody raise a hand for me? At least I'll get satisfied there will be villagers also. It does not mean the villagers exactly. It means the town away from the main city, the capital city. You could be in the town, you could be in the district headquarters, but city will be a villager, away from the main connectivity, the urban. So I thought the people getting referred from there in the simple load carriers, handed over the drivers as usual, settle. Some die on the way. Some were dying, the innocent people reaching those hospitals. On the door, not knowing where from to buy the ticket, where to reach the doctor. Our people are not so much literate. They are not so much exposed. Our rural and peripheral people are very much innocent. Me, when I joined the medical college, I was knowing where is the medical college. The people were not city smart, were not city smart. So seeing those things, the deaths, etc., at that tertiary care in front of my eyes or on the way pained me. I thought, why not decentralize the tertiary care? Why not start a hospital in my own district? That is Kupwara. I dreamt it. I had the conviction. I had the inspiration. I did establish a 50-bed multi-specialty hospital by the name of Quality Healthcare Hospital in Kupwara. This is the first UT-based NABH accredited, fully accredited hospital. We are proud of that. We have all the specialties. We have the hemodialysis unit in that peripheral area. We have the urology services. We have the laparoscopic. Say on the top of the mountains, in those small shelters, some lose the life. And for them also we are ECHS empowered, Ayushman Bharat empowered, ECHS empowered. We have dedicated one theatre, modular theatre. We have 3 model operation theatres. We have dedicated one to them, our armed forces, our paramilitary forces who are safeguarding our countries. In time of crisis, use it. We had the time in May, thing was ready there. Our officers know it, and we are proud, and they are proud. So, a moment of pride for all of us that improving the healthcare and the education. Mr. Gauri, you are doing a wonderful job getting the educationists who are putting some effort in the field. The healthcare, the 6 pillars, the economic growth, the green energy, the other factors of improving the peripheral healthcare. This model can be used all over the country, in other developing countries, in war-torn countries, providing the poor people in a poor country quality health care that means an affordable cost. The surgery which is being done in our tier 2 cities, in our part or in Delhi for 10 lakh, 10 lakh, 8 lakh, 1 lakh, we do it 22,000. Lab cholecystomy in modular OT. So this concept should be how we do it. This is an example. We'll be giving our sessions. We are putting everywhere, wherever get the chance. I feel there will be many others who will tell their stories. I thank you all for listening patiently. Of course, we have to do something. We have to contribute in our bit in each and every way, whosoever, to get the dream fulfilled of Viksit Bharat. Thank you very much.